Hello everyone, welcome to In Real Lore, where we build, play, and learn about 40k. Today I will be going over the ABCs of Warhammer medicine, and Nick will be painting my Kill Team army. So grab your brushes, grab your snippers, or just listen along.
Let us know what you're working on in the comments. We want to hear about your progress or what you'll be working on, and we'll get back to you. We want to know this, like hear your projects, everything. So for now, let's get into today's topic.
Today, Nick has provided me with a series of documents and wanted me to go over them to see how medically accurate they are. Nick, can you give me a little bit of an overview of what documents you've given me and who are they applicable to?
Yeah, so these documents are documents that are one from the uplifting primer from the infantryman. So this is a real book that GW actually put out that is an in-universe explanation of things in the universe. So the documents that I provided to you would be applying to the Imperial Guard, Imperial Navy, and the Ecclesiarchy military. So the Order Hospitaller, and part of the Sisters of Battle, the Adepta Sororitas. So they would use this as a part of understanding how they would triage and how they would treat people medically in the field.
Do people actually care about this stuff?
Do they?
Yeah.
Oh, they made an entire book about it, and like
Let
people
us know in the
read
comments.
If you actually go and try and get the uplifting primer, they're out of print. So if you go to Amazon, I think it's about $500 to try and get a used version of it. It's just an in-universe lore explanation of how people in the Imperial Guard are treated into it. It is typically called toilet paper because it is used that way and it has the same amount of value. It tells people going into the Guard that you can go up and stab an orc in the throat, that the claws of a gene stealer, which are capable of actually slicing through a space marine, are dull.
So is it a medical book or no?
It's not a medical book, but there are medical aspects of it that I have found that I thought would be very interesting to kind of go through.
So welcome to our first installment of Warhammer Medicine. If this video does well and you guys like it and it's well received, we will do more of them. Mainly because I am a doctor by day and apparently a Warhammer podcaster by night. So let's go on. We're going to actually throw, I know you're seeing Nick on the screen here painting. Yep. Normally that's my job, but I actually have to do some reading and looking and some actual real medicine today. So we're going to put the pieces in and around here. So you will see the charts pop up on the screen. We have the standard primer upon casualty prioritization. This is the first document I have been provided with. It looks pretty old. You guys will see it in the screen. And it talks a little bit about kind of priority category going down. So like, when I looked at this, it looks like the CTAS score that we use, primarily in emergency medicine. So I don't do emerge, but it's something that we typically will do. So let's take a look at red. Red is priority category 1. They talk about acute danger to life. Okay. So immediate treatment, evacuate as soon as possible. So this is like your CTAS 1. Nick, I'm going to get you to, we'll put up a copy of the CTAS chart too, so you guys can compare it. And that's what we use on a day-to-day basis. Mm-hmm. So examples of priority 1, arterial lesions. Yep. You don't want to hit your aorta. You will die within I think if you have sever your aorta, it's the stat is for every, if you had an aortic aneurysm that ruptured, for every 1 hour, for every 1 hour that it's been ruptured, your fatality rate goes up by 1%, or I think it's 1 minute. It's something like that. I can't remember off the top of my head, but it's pretty quick. Yeah.
So to a layperson, the aortal, that's just what is an aorta?
Oh yeah, aorta. That's the big blood vessel that goes from your heart all the way down into your body, and then it branches off into all the small ones. So that's the big guy that comes from the heart. Your heart's right here, and then it comes all the way out. I'll put up a picture for you guys. Okay, yeah. What else we got? Amputations, major ones. Cardiorespiratory failure, if your heart and lungs stop working, that's bad. Significant hemorrhage, yes, if you bleed too much, you will die. Sucking chest wound. Okay, so that's actually pretty interesting. People don't know it, but a sucking chest wound is something called a tension pneumothorax. Essentially what happens is when your chest expands and contracts, your ribs go out and come back in. And there's actually a negative pressure that gets created when your ribs go out like that so that you can suck air into your lungs. And a sucking chest wound means that, you've pierced your lungs and it's a one-way valve. So it will continue to take air in as you take a breath in, but there's nothing to come back out. So what happens is you have something that develops called a tension pneumothorax. And this is a real thing. And you have to actually put a needle into the chest to decompress it. You'll see a lot of these things on YouTube and you will actually be able to find it. So that is actually quite dangerous and something that a lot of the emerge docs will do. And paramedics too on the field. What else? Okay, so we have a partial or full thickness burn, yes, of the face and neck, yes. So essentially burns come in all shapes and sizes, but neck and face burns are pretty dangerous, mainly because it's the area of your airway. When you burn an area of your face and neck, you're extremely worried for actual swelling. So what happens is when you get burned, you induce a pretty high inflammatory response. And Nick remembered back in the day, I did a burn presentation. Nick, tell him about it.
Yeah, so it was like I would walk into the house and be like, what are you working on? And I look over at her computer and all I see is just like fissured skin from burns and
category, or like high, it's got like your partial thickness, your full thickness, but nonetheless, we won't be able to. Yeah, I probably won't be able to put up some videos on this. I'm going to keep this PG-13 today. But yeah, essentially burns cause a lot of swelling. So if you have swelling to your face and neck, you can imagine, much like when you have an anaphylactic shock, that your airway is going to close and you will die. Hence why it's going to be in category 1. All right, so we're done the red. Let's take a look at 2, which is yellow. So severe injury. So these people need constant observation and rapid treatment, evacuation as soon as possible. So this is like your CTAS 2, which is an emergency, which you want to treat kind of within a 15-minute time period.
Okay.
Yeah. So let's take a look at what minor amputations, flesh wounds, fractures, dislocation, an open thoracic wound. So let's go to that now.
Yeah.
So an open thoracic wound.
Yeah. Like what is an open thoracic wound? Like what is a thoracic?
Oh, damn, man. I haven't even given you guys that. So what is a thoracic cavity? Essentially, it's your chest, right? So the area of your chest, your ribs, your lungs, and you got your heart, you have your lungs, you have your ribs around there. So if you look at kind of the upper torso of yourself between your neck and your navel, that's pretty much the thorax. So we talked a little bit about a thoracic wound that was a sucking chest wound. An open thoracic wound is much like, think about what's something like, like little, one of these swords piercing one of these little things.
Yeah.
Piercing the chest kind of through and through.
I mean, not quite these because these are saw blades.
I know, but whatever. Like I don't know my Warhammer weapons yet, but essentially think of a wound that goes in and has an exit. So what happens is you have both an entrance and an exit from your lung. So whether or not it enters from the front, it exits from the back, or enters from the front, exit from the left, air can come and go in. So it's not continuously coming in, and it's a one valve system. So an open chest wound is just such as that. So think about a bullet going through it completely.
Through and through.
Yeah, so it's quite dangerous still because, you could collapse a lung, you may not be able to breathe, and you still need to be treated at a pretty high at a high CTAS level or a high acuity level, but it's not as bad as like a tension pneumothorax where air comes in one valve, your chest keeps blowing up, blowing up, blowing up. It actually compresses your structures from the inside. That's bad. Okay, what else do we got? We have severe eye injury, avascular limb. Ooh, that's an interesting one. Okay, so I don't know if you guys know what an avascular limb is. Nick, do you know what?
I don't know what it is.
Right,
I'm a layperson.
You're a layperson.
I have little toys.
Okay, so what is an avascular limb? I'm going to show you my hand here, right? So this is a limb. A limb is like your hand, your feet, your leg. And an avascular limb means that you're not getting blood flow to the limb. And it can happen in a variety of ways, right? So in your body, you have arteries and veins, and arteries take blood from the heart and go all the way into the hand and give it blood. Veins, which are blue, take blood and come all the way back to the heart. An avascular limb means that the piping that is taking blood to your hand has been stopped. So whether or not it's an amputation or you had a cut kind of right around here, for example, and you can no longer bring blood to the arm, for example, or you have a lot of swelling in here and it's compressing the veins it's compressing the arteries that go into the bottom of the hand. That's essentially an avascular limb. Those tend to be actually very, very significant. And you can... Oh my God, what are you talking about? You're doing those things?
Yeah, I'm doing these things up top. It's kind of nice. I'm going to be honest. Talking.
I know, but this is what I do all day. Like, they gave me no prep work. He just said, here are the documents. Now teach me shit. Okay, so an avascular limb essentially needs to be treated within 6 hours. If you wait any more than 6 hours, you are likely going to have to amputate that limb, or that person will die of septic shock. All right, what else do we have here?
Septic shock?
Yeah, so basically, shock is when your body just starts breaking down. So it's a combination of signs and symptoms, but essentially your blood pressure goes down, your heart rate's going to start tanking, and just blood perfusion. So blood flow to the body is going to start breaking down as well.
Okay.
Septic means you're infected.
Yeah.
So, if you're going to have an avascular limb in battle and you're not able to treat it, sometimes it'll create like bad blood products in the body and actually cause, so septic shock is just bad deal. Don't want to go into too much or you guys may probably lose me during this conversation. I wanted to keep it as easy in terms of to the layperson as possible now.
Yeah.
Well, giving you a little bit of an overview of how accurate this is in the Warhammer world and how impressed I am so far. Okay. What is next? We have partial. So we're still in the yellow category. Partial or full thickness burns, not involving the face, neck, or perineum. Yeah, because those are not high risk areas. And then we have the green category, which is a minor injury. So that, looks a little bit more like kind of a CTAS level 3 and 4, which is what we use in our day-to-day life in the Emerge. And if I go back here, sorry. Okay.
Oh, there's
so this one is
much metal on these girls.
I know. I'm actually really glad I get to talk. This is easier than actually painting. So treatment when practical, transport and or discharge when possible, summary execution for cowards and Okay, Nick, what the heck? What is this execution crap I'm reading?
So because in the Imperium, there's just bodies everywhere. If someone's not going to do the duty, it's just easier to kill them off and find someone else to replace it than it is to actually
not
deal
accurate.
with it.
In real life, we don't execute anyone.
No, we don't. I'm pretty sure the medic's not going there and being like, "Oh, you have a spleen and you don't want to fight.
Here's some morphine."
Morphine. Why would you waste the morphine?
I know. You just take a blade to the
Imperium. It's just. You know what? You didn't fight. You're going to die an example now.
Okay.
Die a hero or die an example.
So that is not accurate in terms of the execution of cowards, but interesting. Then we have what are examples of stuff that would sit in category 3? Minor lacerations, sprains, abrasions, contusions, superficial burns, partial thickness burns of less than 20% of body surface area. So interesting thing about burns actually is we classify them based on how deep they are, but also how much of a body surface area they take. The more and more parts of your body, so the larger surface that is burnt, essentially, the more and more you're going to suffer from the catastrophic effects of burn. So they dehydrate you, they can get infected, and they cause an enormous amount of swelling, and they are extremely painful. So this one here, you're not burnt too much. If you ever wanted to hear an interesting statistic of what 20% of your body surface area is, take your hand, and just the palm surface of your hand is 1% of your total body surface area. So getting 20% of that burned is 20 of your palms if you go over your hand. And that's how you can quickly estimate when you see someone in battle, for example. You take the palm of their hand, and then you're just going to put that palm over and say, okay, about 5% of their body surface area has been burnt because I can fit 5 palms on that area. Okay, so now we're at the blue category. So the blue category is no or small chance of survival. So now we're getting into kind of really significant things. So in kind of acute medicine, when we're triaging stuff like this, this here is, you're kind of giving up on people. So you're still in the CTAS 1 category, so we've kind of gone back up. So you do not expend unnecessary time or resources. Administer Emperor's Mercy. I think this is very Warhammer specific because usually we try to actually save people.
And the Emperor's Mercy is typically just a bolter.
What's a bolter?
Bolter is the big gun, essentially.
So
or you get a las pistol.
You're executing them?
You're giving them the mercy of the Emperor. Okay. The Emperor has deemed that you're not capable of fighting and serving.
So what I find really interesting here is the examples of it are severe physical or psychic injuries, uncompensated blood loss, negative neurological assessment. Like, what the hell does that mean? Half the stuff can fit into the red category. Like a severe physical injury, if you have a thoracic sucking chest wound, like a tension pneumothorax, as per this, I could also just execute them.
If you
and show them mercy.
Yeah. I was like, okay, well, you're not going to survive. Okay.
This doesn't make sense because the red and the blue are the same. Oh, man.
Remember, so a lot of these documents, while they might get somewhat accurate, are not written by medical people.
I know. So
they probably have just got some documents from it's UK. So whatever their health system is.
What is the psychic injury crap? Like, are we talking about psychosis? I'm not killing someone who's got psychosis.
No, psychic injury would be someone that has been affected by psychic abilities.
Oh, dear
so
God.
Remember the warp abilities and, someone who's mentally been like affected by the warp or anything like that.
Yeah, don't understand that. Okay. And then I don't understand what uncompensated blood loss. If you have uncompensated blood loss, I'm assuming to even me, the doctor person, not even the lay person, that just means you're bleeding out. If you're going to bleed out, you're killing yourself, unfortunately. I don't need to execute you. Like, if you have a true level of blood loss.
So it's just a waste of resources to kill the person.
Yeah, it really is. You're going to waste a bullet. I'm just thinking pragmatically, right? Like, I'd give them morphine. Like, I'm not going to give them you'd medicate them. You wouldn't execute them. You'd execute the cowards. You don't execute the people who are actually dying, right? You help them. But essentially, if you think about uncompensated blood loss, we have about 5 liters of blood in our body, if I can recall correctly. And losing any more than 1 liter is really, really bad because then you're not able to kind of perfuse or send blood to different areas of your body. And as soon as your brain is no longer able to receive blood, you're going to get some irreparable brain damage effects. So you can only live so long without oxygen in the brain or blood in the brain. So, to be honest, if you have really bad blood loss, you will probably be dead on arrival. Okay, what else do we got here? Negative neurological assessment. I'm just assuming that's really bad brain damage. So we have something in real life called the GCS, which is the Glasgow Coma Scale. I will stick it up on here so you can kind of see. It'll be on kind of one side of the screen here. You can just see what we use. But anything less than an 8, you pretty much should be intubated. It's like less than 8, intubate. That's the rhyme that we learned. Mainly because your brain does not function enough to tell your body to breathe. And no, seriously. Yeah, because do you guys think about breathing right now? No, you've probably taken 200 breaths while we've been talking.
Well, now I'm thinking about breathing.
I know,
Thanks.
right? But your cerebellum does the breathing function for it. But when brain damage is so severe, you're no longer able to do that, which is why we use that score. So I'm thinking that this year is a GCS score of less than 8. You're probably going to die. I don't know if they intubate in battle. We'll find out. Okay, last one here is Category 5, deceased. Collection and transport bodies if possible. Identify if possible. Do not expend unnecessary resources or time. So these are dead on arrival, which is DOA, downgraded from 1 to 4. No spontaneous breathing. Breathing after airway cleared. What? Oh, I got it. No spontaneous breathing after airway cleared. So what I find interesting here, actually, Nick, so they do answer my question. Category 5, which are dead on arrival or deceased, are those who have been downgraded from 1 to 4. So it's interesting in how they wrote it because you're not going through 2 and 3. 2 and 3 are people who are not as sick. But 1, if you're sick enough in 1, you can actually jump down to the blue category 4 where it's no chance of survival.
Yeah.
At least that's my interpretation.
So that makes more sense. Yeah. So that way you kind of start in red if you're bleeding out and then it's just okay, you're not going to live. Okay. Straight to blue.
All right, we're gonna put this quote up for you guys. Okay, we'll clip it and put it up there. But listen to this: cowardice and malingering is not to be tolerated by medical personnel dutifully serving the emperor. Any casualties displaying signs of cowardice, page 78, uplifting premier, or to have inflicted injury upon his or herself to be excused from active duty, shall be flogged, flayed, and then executed, or shot in wartime. So basically, don't be a pussy. Yeah.
No thought process behind it.
No.
Just to me.
I agree. In wartime, there's no point, right? But you know what malingering means, right? Malingering are those who constantly think that they're ill or come in and it's one
hypochondriacs.
Of those kind of, but kind of not. Okay. And because hypochondriacs truly believe they have something going on with them, but malingering means that you're making up an illness. So I think that they're making up, I believe, someone can correct me if I'm wrong. It's been a while since I've done my psych. I do sports med, not psych. But essentially that's what it is. What else medical personnel should not attempt to treat those suspected to be rendered impure from warp taint. In such cases, administer the emperor's mercy as per Act something. Defer to relevant ecclesiarchy personnel in such cases where warp or diabolical taint is severe. I am going to have to consult Nick on this.
Yeah, so it's basically because the warp taints you, you become infected with it. It's not necessarily something that can be easily cleansed from you. It's easier just to clean the world.
How does one get tainted with warp? Do I touch you?
It is either by being in the presence of warp artifacts. So it might be something that has the taint to it. It might be seeing demons. It might be being near someone that is a psyker that has then done something to you within your brain. That's why it has that in category in the B or in the blue category. Mm-hmm. I also realized after you were saying you don't like cowards, you'd make a perfect commissar.
What's a commissar?
A commissar is the person that's boosting morale. They're a political person that is yes.
I think I'd be good at it. Yeah.
And you shoot the cowards.
Yeah, I think I could do it.
Because you would just
I'd probably be a doctor on the field, but I could, apparently doctors have to sacrifice people as well who are cowards.
Oh, yeah.
Okay, one more thing on here. So in the field, it may be pertinent to reverse priority and treat less severe patients first, where treating fewer casualties of greater severity may lead to the worsening condition of a greater number of casualties with a lower severity of injuries. This is the discretion of the medic in the field unless specific orders have been received from a superior. Where casualties are of equal rank, saving 2 guardsmen or shipmen is always preferable to saving 1. It makes sense. In wartime, I am not expecting to save my CTAS 1, or at least in this category 1 and 4 patients, because you're going to need people to fight. So essentially, you're going to need the walking wounded. You patch them up, you send them back up on the battlefield, and you just need the numbers, right? Wartime medicine is very different than kind of day-to-day medicine. Like the type of category 1 and 4 is going to be prioritized in the emergency department or wherever the Warhammer people go and seek care afterwards. I don't know. But in the field, it does make sense. And I do agree with that. And it is true to some degree. Like when you get deployed in as part of military medicine, like, yes, you have a military field hospital, but you are going to try, like at the end of the day, if someone is stuck and they're amputated and their leg is kind of blown off by an IUD or whatever weird stuff, Warhammer stuff can blow off your leg. You leave them.
Almost anything.
Yeah, I mean, there's a no man left behind, but in some cases you may have to because it's the safety of the rest of the regiment and the army.
Yeah.
Okay. I mean, this looks pretty, I'm pretty impressed. This is like pretty legit.
So they actually do some pretty good research on it and like making sure that things are accurate. I've seen people who are in the military look at the uplifting primer and say, yeah, that makes sense. Yeah. Like it's 40K, but it's also like, it's just as dumb in the real military.
I mean, like the medicine aspect of it is pretty interesting. I don't agree with how they do the 1 to 4. I think 1, 2, 3. It should be like 0, 1, 2, 3, for example.
It should be like sequence.
Yeah, if you look at our CTAS category, right? 1 is really bad, and then 5 is like walking wounded, right? And that's how you get triage when you go to emerge. If you're 1, we're wheeling you into the resuscitation bay because you're going to die within the first 15 minutes of being there. Whereas if you're 5, you can wait in the ER for like 20 hours, which is why people do, unfortunately, right now, right? So, okay, so next thing Nick wants me to take a look at is the casualty categorization diagnosis chart. So much like most of you guys, this is the first time I'm seeing half of this stuff, but hopefully I'm giving you some good insight onto it.
So far, I'm getting insight.
Well, I mean, I know you guys love the lore behind it, but if you truly love the lore behind it, you're going to love the medicine stuff behind it too.
Oh, yeah.
All right. So we'll put this up on the screen so that you guys can follow along, and we'll put both the charts together because there is some color coding as well. So this one is applicable to casualties of physical attack. Preliminary steps. Applicable to casualties of physical attack. Remember to follow additional precautions for xeno-weaponry, i.e. Tyranid bioweapons and Necron ghost of what the frig. So, and ghost devices as prescribed in medical manual DA4. What the hell?
So Tyranid bioweapons, basically, when they hit you, it's not necessarily that you're being hit with a bullet. You are being hit with a tiny little bug that is then going to like dig its way through your body.
Ew.
A gauze weapon.
Like a parasite.
That's
we have those. They lay eggs in your body and then they come on out. Like this is why you don't walk barefoot when you're on. I forget what it's called. I forget what it's called. If anyone knows, put them down below. But it is something in tropical medicine. You do see it. Don't walk barefoot on the beach while you're down south.
I'm trying to remember that. But yeah, so that's what Tyranid weapons are basically. They're all based on that because everything they are is bugs. And then the gauze weapons basically just deatomize and like destroy your body.
So basically if you're hit by that stuff, you ain't getting my help.
Probably not.
All right. So
probably best not to. You just Emperor's Grace is easier.
What's Emperor's Grace?
The Emperor's Mercy.
Oh, you killed them.
Yeah, you killed them. Just
so
put them out of misery.
All right, let me continue on here.
Yeah.
Medical personnel should not approach those suspected to be rendered impure from warp or diabolical taint. Refer to ecclesiarchy personnel for administering the Emperor's benediction. That is...
Again.
Okay, cool.
Probably with some more prayers and stuff.
Yeah. I'll skip it. All right, so we got step 1 here. So this is actually a really cool chart when I was taking a look at it because this talks about the ABCs. And this is exactly what I'm titling this episode. I am calling it the ABCs of Warhammer 40k in the Imperial Army. And essentially step 1 is assess and position airway and check breathing. So if you think about it, ABC stands for airway, breathing, circulation. And usually some people will say, when you're treating somebody, you got to do CABC, for example, whereas C-spine, airway, breathing, circulation. I actually have done some videos on it. I'll actually link one video to it. It is not on this channel, but it is one where I've done that. And it goes through kind of the ABCs in real human life. So you check the breathing and the airway. So they're pretty accurate on step 1 there. And then it's, oh wait, sorry. Oh man, okay. This chart's a little confusing. So where it starts is not that. Is casualty able to walk? So if it's yes, then you're classifying them as minor. If you can walk, then you should be breathing, your airway should be open, and your circulation should be fine. Usually people who have an ABC problem, for example, are not walking, they're unconscious and they're on the ground and need some help. So then it says no, if it's not able to walk, then you assess and position airway and check breathing. And then it talks about going to step 2. So this is where we start our ABCs, airway, breathing, and circulation. Did you want me to reference my channel or no?
Yeah, no, absolutely.
Okay, cool.
Yes. Sony wants to reference her channel because she does have clout.
What?
You have clout. You have an actual channel. You're not just on here.
Yeah, no, I do.
Hand.
It's in my thing, you know. You can actually see my face then. You may not be able to see Nick's face. He hasn't done a face reveal yet.
Yes,
okay.
I have. I'm on your channel.
Yes, he is. Oh, man. So we're real people, okay? And I am truly a female, I think. All right. So, okay. Let me continue. Step 2. So it says, that's when assess and position airway, check breathing. So now we're going to talk about, it talks about, okay, if, I don't know why it says no, reposition airway. I guess it's saying assess airway and breathing. So if the airway is not open, reposition the person, check the breathing. So you're going to want to take your ear. So first off, see if their chest is going up and down. You're going to want to see that. Or you can listen to their mouth. I mean, in COVID times, you may or may not want to do it. I don't know how Warhammer feels about COVID right now, but I'm not putting my face next to someone's ear right now without a mask.
Oh, you'll probably be trying to look for warp taint because that would be Nurgle's blessing coming into play.
Oh.
Because Nurgle is all about them plagues in COVID.
Yeah.
COVID is Nurgle's favorite thing.
So get this. I love this. It says, okay, so reposition airway. And it says now breathing. Yes. And then you can continue on. If you're not breathing, you are dead. And it says category 4 and 5. I love how they don't do intubation, bag mask, like bag valve mask or any of that stuff. Like they just say check breathing. If not,
dead.
No. It says position their airway, position their head, check breathing again. If they're not breathing, they're dead. So I guess they don't do much for first aid kind of in the field because usually we do something like ACLS, right? So we have I check your breathing, for example, and I come in ABCs, right? So first off, are you breathing? Is your airway open? I look in your mouth and then I check to see if your chest is going up and down. And if you're not, first off, I see if there's anything in the mouth. And if not, we're going to start compressions and or breathing at that point in time, right? And we have different ways to help people breathe, but essentially you can put a tube in the mouth to open it up. It's not a full intubation; it's just a tube to kind of open up the airway, and you have a mask that you can put on top of someone's face, for example, to administer breaths. Or we used to do mouth to mouth back in the day. I don't know if we do much of that these days, but we definitely have a bunch of steps. I think in Warhammer they just say you're not breathing, you gone, right?
No point in spending extra effort.
Okay, so then. It says here, so now breathing, yes. So if breathing, check rate. So I guess now they're asking to check the rate of breathing. So a normal person breathes at about a rate of anywhere from 12 to 18 breaths per minute. So here it says, if it's above 30 per minute, treat for shock. That's kind of interesting because the definition of shock is not a high breathing rate. It's typically that your blood pressure is tanking and your organs are failing. And because you have a high breathing rate, it does not mean your blood pressure is tanking and your organs are failing. So this is it's interesting. But essentially treating for shock. So they're saying we're going to put these people in category 1, where if their breathing rate is over 30 breaths per minute, they're acutely on the verge of dying. You could just have an anxiety attack. I don't understand this.
Yeah, but it's in the Imperium because then you could just be a coward if you're having a panic attack.
I don't know. I just, you have to get to the circulation aspect of this, right? But I guess they're saying if they're breathing more than 30 per minute, they're in respiratory failure, which means that when you start breathing more, I don't know if you've ever seen anybody who's had true breathing issues, like not an anaphylactic, but like an asthma attack, for example. If you've ever seen someone who's had an asthma attack or a panic attack, you start breathing more and breathing faster. And that's kind of it uses a lot of energy. So first off, if you breathe more and breathe faster, you start blowing off a lot of your carbon dioxide. And that's what makes you dizzy and and that makes you want to faint. But you also tire out a lot of the rib muscles and a lot of the muscles like your diaphragm that help you breathe. So if you continue to breathe fast and you're not able to stop it, you could pass out and you could actually fail and develop full-on respiratory failure.
Okay.
So I think that's what they're thinking about. Now, if we go to the other end of that chart, under 30 per minute, that's when we say, okay, so you're breathing under 30 breaths per minute. You're relatively on the normal breathing-ish side, so I'm not worried about breathing. So now we've gone through A, Now we've gone through B, we've checked that off, and now we're going to go to C. And it says here, check circulation and control bleeding. So C stands for circulation, and there's a few things we think about. 1, check for bleeding, control bleeding. 2, make sure that the blood pressure is appropriate. And the way that you do that is that they have a good pulse, and there's no open wounds that are bleeding a lot because you don't want to lose a lot of that fluid. So then they say here, you now want to go to step 3 if you're at that point. And step 3 says, okay, check bleeding, control, or check circulation, control bleeding. And then it goes down and it says, assess the capillary refill, which is the Blanche test. This is pretty accurate. I mean, I'll be honest, in an ACLS or an ATLS, which is the trauma version of ACLS category, I'm not sitting there checking capillary refill. I'm literally putting my hand on your pulse. And if you don't have a pulse, we are starting CPR. And if you have a low pulse, we are giving you a ton of fluids. But usually capillary refill is more nuanced. So if you look here, this is capillary refill. Well, I blanch my tip of the finger and I let it go. And that came back in about 1 second. So usually capillary refill is a sign of kind of peripheral circulation. So circulation in your fingers and your toes. And in a trauma setting, you don't give a crap about this. You give a crap about your big vessels because, I mean, this stuff could be crap when you're in the field and you're acutely dying. Whereas this, as long as this is intact, your big pulse, we're not worried about it. You can get this back later. But essentially, yeah, you blanch the body by pressing, and then you see how long it takes to come back. Anything more than 3 to 5 seconds is slow, and it tells you that the body is starting to shut down slowly and not provide blood flow to certain areas. If that happens, that is dangerous. So that's why they're asking you to check for the capillary refill. So now it divides into 2 categories here. So if it's above 2 seconds, this is when you're worried that blood flow is not getting to certain areas. So something is happening and they are likely bleeding out. And this is when they go down and say control bleeding and a treat for shock again. So they're category 1 at this point in time. If it's under 2 seconds, then they say, okay, that's normal. So now you're going to check their mental state and you're going to go to step 4. Ooh, step 4 means that they have psychiatric problems and they die, don't they? I don't like that. No, step 5. Sorry. No, it says go to step 4. Sorry, my fault.
Okay. No, all good.
Yeah. No, I'm just taking a look here. I want to go back. And if I take a look here, it says, do not expend unnecessary time or resources. Administers Emperor's mercy. So if you go through this entire ABC and you're at... Ooh. Oh, no, I misread this. Sorry, guys. When it says go to step 4, it means go to the step 4 of the chart. So if you
go to category 4.
Yeah, I was like, holy crap, that's like, I'm already committing mercy for you.
I'm already trying to commit.
So if you go to the right-hand side of this chart, there's a step 4, and it says check mental state. So this is where now they talk about a few things. Fails to recite the litany of faith. What does that mean?
So basically, can they recite can you say oh, praise the emperor, the emperor is God, the God emperor's light is within
me? Pray?
Yeah.
The prayer?
If they can recite the prayer, then they're psychically fine.
Listen to this. So if you can recite the prayer, you need to treat them immediately for shock. I'm not even joking. It says immediate treat for shock. It's like the we use alert oriented oh man, it's like your name, your place, the date, person, place, and time, for example.
Yeah.
But if you can recite the prayer, you are in shock and must be treated as a category 1. Now think about this. If you fail to recite the prayer. So if you cannot recite the prayer, you're in shock. Okay, that makes more sense. So if you cannot recite the prayer, they are so worried about you that they're treating you for shock. And now on the other side of this chart, if you can recite the prayer, then they put you in category 3. You're delayed. You're fine. You're kind of walking wounded at that point in time.
Which makes sense. Yeah.
That does make sense. So I guess the prayer is their version of alert to person, place, and time. It
makes sense because it may be your work corrupted too, and you cannot say it because it might cause you to have issues.
But then I'm not allowed to touch you if your work corrupted. Well, so then I can't even do this kind of thing.
Then you leave them alone at that point. He's like, oh fuck, I'm more corrupted shit.
Yeah. But then you don't even go through this category. But I kin that as is we ask people, and this is where that Glasgow coma scale comes in again, but it's really, are you alert to person, place, and time? So do you know where you are? Do you know who you are? Do you know what day it is? And I think they're using the litany of faith as their version of person, place, and time.
Yeah.
Yeah.
Okay, that makes a lot of sense. It's kind of neat that they did it that way.
There we go. I mean, it's kind of accurate to some degree, especially because their ABCs are on point. So whoever made this did definitely look at the ABC categories, although there's some silly things in here.
Well, yeah, and that's kind of the whole point is they flavored it to 40K, but they kept it as accurate as possible.
Okay, next.
Could someone actually take this that full thing and say like, I can treat someone in the field now with this?
No, because it tells you to check something and then treat them as like, immediate or something like that, like for shock.
Yeah.
The problem is it just tells you what category 1 is. It tells you the action, but it doesn't tell you how to treat them in this.
Yes.
So, and that's the part that I guess I get paid for. The how to treat, right? The theory is like, you can study this stuff nonstop, but once you're in the field and when you're seeing someone die in front of you, it changes everything.
Everyone has a plan until they get punched. Is the same thing.
It's true. And one of my best friends is a merge doc, and she does this stuff on a day-to-day basis. But I do remember when I was in residency on call, like you're covering the wards, and when someone's sick or something like that, you have to come to them. And one thing I was constantly told is, in these weird settings, I was very calm and I kept my cool and collected. So apparently I like stuff like this. But you have to be able to memorize this stuff, but then also put it out and use it in kind of the most stressful periods of your life, right? So until you algorithmically like really put this in, like you need to practice this stuff, right? So a lot of these medics are, they're going to be doing simulations. They will be practicing this stuff. They will figure out how to do things. And that's why and also in war, you need mass casualty protocol, right? Which is why they have the scoring that they do at the end of the day. So Nick and I wanted to kind of, if this is something you guys really like, I am totally down to do kind of a Warhammer medicine series because I enjoy medicine. This is what I do on a day-to-day basis, and I'm able to kind of at least translate a lot of that knowledge. So if anyone has any questions, comments, or really likes this type of idea, please let us know down below because we will do more episodes on this. They take a lot of time to set up, so we just need to know if there's truly some interest in it.
Yeah, and then we can try and go over and have it as a part of our podcast episodes.
And that wraps up the ABCs of Warhammer Medicine.
Thank you, everyone, for listening to today's episode. If you want to support us, follow us on Patreon, please like, subscribe, comment, and follow us on whatever platform you use to listen to podcasts or watch us on YouTube. Thank you for listening and have a great day.
Until next time.
Bye.
Peace.